Hi there, my name is Susan O'Kelly with Avanti Health First. Welcome to my Medicare 101 seminar. At Avanti Health First, we are an independent agency and we are dedicated to providing free consumer education about Medicare, how Medicare and Social Security work together, and teach you some of the things you need to know to avoid the most common pitfalls. We want to be sure to help you with your health insurance now, when you retire, and for the rest of your life. All right, so grab a piece of paper and a pen, take some notes, and let's get started. So we're going to talk about Original Medicare first. It is a federal health insurance program, and it's great. It is designed to provide basic health insurance benefits to people over age 65, and for some people under 65 that might have some chronic conditions and or disabilities. Part A coverage is typically $0 a month for most of us, and it's the hospital coverage piece. And Part B coverage is when you go see the doctor. And that premium is $185 a month. I put it on this slide here kind of as a little note. We're going to come to it in just a moment here. If you're going to be looking at quarterly billing, it will be $555 every quarter. So Original Medicare Part A and B. Now, if you're already receiving Social Security benefits and you're getting ready to turn 65, it's really simple. You're going to be automatically enrolled into Medicare, and you should be receiving your ID card about 3 months before your birthday. And as I said, that Part B premium, $185 a month. Because you're already receiving Social Security benefits, it will come right out of your check automatically. Well, if you're not yet receiving Social Security, it's a little bit more complicated. It's not too bad, but you have to do a few things manually. So you notice on this calendar here, reminding you about 3 months before your 65th birthday, you want to get into the groove and think about that enrollment. The best time, 3 months beforehand, just so nothing really happens. And it's so easy. You click on the link to apply now. Once you get to socialsecurity.gov, it's really easy to navigate, or you can take a screenshot of this picture here. You can also call 1-800-772-1213 and get somebody on the phone to help you with the basic enrollment. Of course, you could go in person. You can also mail your application. Now, if you do this in this manner, this is when you will get billed quarterly. So I've done the math for you, $555 a month, $185 a month, quarterly is $555, right? All right, you didn't have to get your calculator out for that. So how about if you're still working? If you're still working and you really like your insurance plan that you get from your company, that's great. You could decide to do nothing. And for many of us, if we're working for a large enough company, you're going to be automatically enrolled in Medicare Part A. If it's a smaller company, you'll have to do that manually. And again, we suggest Medicare Part A 3 months before your 65th birthday, so it's ready to start on the first day of your birthday month. Now, if you delay, it's no problem. Not a big deal at all. You can delay your Part B enrollment until after you retire. There are a few things that you want to be aware of. However, be sure that you stop your HSA contributions at least 6 months before you get ready to enroll in Part B. That's the second step. Remember, you enrolled in Part A, manually maybe your company did it for you. But if you're contributing to that HSA, you need to strategize that retirement process. Okay, let's move on. We've talked about the original parts of Medicare, Part A and Part B, hospital and doctor, the federal insurance plan, and I want you to think about it like an 80-20 plan. However, what that means is that if Original Medicare pays for 80%, it leaves that 20% gap in coverage, and we got to do something about that. What those exposures are for you means that if you have hospital coverage and you're going to have a deductible of $1,676 for each hospital stay in a benefit period. And a benefit period is different than a calendar year. That benefit period is 60 days. So you go into the hospital, you've been released for 60 days, and then you go back into the hospital. That's another deductible payment. So you can go in more than one time in a year and have more than one deductible. The Part B doctor coverage, that's a little bit scary too, because the Part B deductible is $257. Sure, that's a calendar year, but your coinsurance is 20% and it has no limit. 20% of a major situation is a lot of money. And the Part B excess charges. Now, a doctor that's only billing original Medicare is allowed to charge up to 15% on the bill that you would be held accountable for. So 20% of $100,000, that's a lot of money. 15% of $50,000 on something, that's a lot of money. We've got to fill that gap in coverage. And we do that with some other things. Welcome to the alphabet soup. We've talked about Part A and B. Below the line, you can see we've got Part C, Part D, which is your prescription drug plan, and Medigap or Medicare supplemental. In some circles, we still hear that called Part E. We're not going to go there today. Part C, let me back up, Part C is bundled. So getting into all of this, we're going to go back in alphabetic order and start with Part C. We also call that Medicare Advantage or MAPD. My head's kind of covering the screen, the plan options, but you can kind of tell that it's a third-party insurance plan. It covers and takes care of original Medicare Part A and B for you. And it also, in many cases, includes a Part D drug plan. The benefits and drawbacks. Well, it's really, really great because if you like having dental and vision and hearing and all those wellness benefits, those are great things in these Medicare Advantage plans. However, the plans typically have the limited provider networks, and even if you're on a PPO, and there are specific rules. The costs are, for Medicare Advantage plans across the nation are pretty good. There's a lot of $0 premium plans. You can get into a $30, $50 a month plan. That's okay. They're very, very affordable. You also have to remember, though, that you have to continue to pay your Part A and B premium. Don't forget that. And the costs will vary by plans. So if you have a different type of a plan in a different location, a different zip code, a different state, those things can vary on the premiums and coverages. Now, let's get more into detail on the coverages. Some of the drawbacks on the Medicare Advantage plans is that they have co-pays, co-insurance, and maximum out-of-pocket deductibles. I've got it here that there's a $3,000 maximum out-of-pocket, which is not surprising, but I've seen them go up to $10,000 and $11,000 depending on what part of the country you're in and if you're on a PPO. Also know that there is going to be a separate drug deductible. It's $590. We'll see that in a minute. And they also have their maximum out-of-pocket ceiling. That's in addition to the Medicare Advantage portion of things. So bear that in mind. We'll do a summary in a few minutes here. Part D, prescription drug plans. These are also offered by third-party insurance companies, and they help cover the cost of drugs. It helps pay for generic and prescription name drug plans. And they have really variety of costs as well, in terms of premiums, that is. It depends on the plan, the location, the state that you're in, and it also depends on your prescriptions. Now, the average drug cost plan I'm seeing is $25 to $35 per month. There are many low-cost plans available, and we just want to take a look at your prescriptions. And speaking of prescriptions, so drug plans classify the drugs into tiers and formularies. And formularies are nothing more than a fancy word for the list of drugs on that insurance company's plan. So there are different costs associated with your drug and the plan that you might be on. We're going to help you every year and take a look at that. You'll see when we get a little bit further why that's important. So in 2025, I mentioned it in passing, the deductible is $590 and the maximum out of pocket is now only $2,000. That's really, really great. I want to point out that when we get kind of through the end of this, you're thinking about a Medicare Advantage plan and you think, well, why, if I've got prescription drugs with my Medicare Advantage plan over here and it's a $0 plan and I get all the wellness benefits and dental and vision, why can't I have that standalone drug plan over here with this company? Well, you can't have the two at the same time. It's sort of like you can't drive a car and a motorcycle at the same time. So we'll get into a little bit of some of the rules and how you want to think about enrolling, but the plans themselves, when it comes to prescription drug rules, there are a lot of similarities. At the end of the day, you have a $590 maximum for your deductible and the $2,000 maximum out of pocket for the cost of your drug plans. All right, here's how they work. So you have a deductible phase. Your drug plan might ask you to pay everything for a prescription until you reach $590. And then at that point, you pay 25% coinsurance for a particular prescription until you've spent $2,000 out of pocket. After that, you go into what's called the catastrophic phase and you pay nothing. Now, in 2025, we saw this change in prescription drug plans. Oh, my head's covering it again, but I'll help you out here. So the plan is going to pay 60%, the plan that you select, whether it's Medicare Advantage or standalone, will pay 60% of that drug cost. Medicare pays 20%, and the manufacturer pays 20%, and you pay nothing. Love this. And here's our process. We're going to help you and walk through the prescriptions that you're on, and we're going to input them into the online tool that helps us look up prescription drugs and compare them with different plans and different carriers. You're also going to tell us your preferred pharmacy, and we'll look at mail order versus your preferred pharmacy. Zip code is very important. You're going to hear me ask and talk about zip code frequently. That's the driver for all of this. When you enroll in your plan of choice, that's great. And then we're going to reevaluate every year at the end of year. Annual enrollment starts every October 15th, and goes through December 7th. And we want to talk with you and be sure you haven't had any changes in your prescriptions that are going to change your drug plan. All right, let's get to Medigap, the Medicare supplemental plans. Really important, write this down. Medigap plans are secondary to original Medicare. They don't coordinate. It's not bundled in any way. So that means when you go to the doctor or the hospital, Medicare is the first to pay, and then the Medicare supplemental plan is what comes in second. Now, these plans are great. Of course, these are also third-party health insurance companies. They're private companies. What's really great about these is that these plans are all standardized across the board. I've got a graphic I'll show you in just a moment. Each of these plans, you're going to see, they offer varying levels of things that you might want to fit your lifestyle that are going to fill that gap, that 20% gap that we're looking for. The enrollment period for this is really great. The best time, sweet spot, is 6 months ahead of time. And notice I've given you a checklist. We told you I want to help you to avoid those mistakes. We want you to avoid mistakes, get the best rate, and of course, enrolling in Medicare is complex. We want to have you get it checked off your list so you can go enjoy the things you enjoy doing and not worrying about Medicare. All right, how much does it cost? So remember, you still have to pay your original Part B premium. That is always going to be the case in any of these additional options you choose. Now, the plans that we're going to see in a minute cover varying things about the Medicare, the original Medicare Part A and B stuff we're worried about, but premiums are going to vary, and they're going to vary based on plan type and, of course, location, zip code. And the average plan I've discovered is right around $175 to $200 per year. Caution, I've got it here with a red bullet point. They do not include a drug plan. So this is the time where you will choose a standalone drug plan. Standalone drug plans and Medicare supplemental plans go together. Make sense? All right, let's move on. Here's that nice chart for Medicare supplemental insurance. And there are, across the board, remember we had that deductible for the hospital insurance. The Medigap plans all take care of that $1,676. That's number one. And then after that, you kind of want to look at what's that coinsurance or copayment. For example, on Plan L, it will pay 75% of that Part B, the $257. that's why we want to talk with you and figure out, well, what's your lifestyle like? We're just going to run through these pretty quickly. There's some blood benefits, skilled nursing, Part A deductibles vary. Part B deductibles are going to vary. Excess charges are going to vary. Emergency services, you're going to get some basic coverage. You still have 80%. And there are limits when you look at Plan K, Plan L. What are those limits on that extra expense charge? So bear in mind, we want to talk to you about what your lifestyle really looks like. Medicare plans, which one are the best? I get this question all the time. Plan G or Plan N? Well, you can see for yourself. The premiums for Plan G are higher, but they cover more things. Whoops, we jumped ahead. Plan G is obviously higher because it covers more things. Plan N is a little less expensive, but notice it's not that much, and it really differs on the things that it covers. You still have to pay all of the deductible for Part B. You still have a copay to see your doctor, and it's $20. You still have a copay to visit the ER, and look at that. It doesn't cover the 15% excess charge. Again, we want to look at lifestyle, what's important to you. Now, the next question, well, we talked about Medicare Advantage and we've talked about Medigap, which is the best. When you start looking at your lifestyle and your crystal ball, do you want to have lower cost out of pocket for the premium and pay more if you have to go to the doctor or go to the hospital? Or would you prefer a Medicare supplemental with a fixed cost every month that you know what it is, and when something bad happens, you pay very little? And here I've laid it out. You can see you have to remember to pay the Part B premium. It doesn't matter. In Medicare Advantage plans, you're stuck with that network of providers. And with Medicare supplementals, you have whoever takes original Medicare, they're contracted with Medicare, you can go to them. Also, in a Medicare Advantage plan, that Part D drug plan is usually bundled. Medicare supplemental plans, you have to pay that separately. It's a whole separate plan. So choosing the right plan is really, really important. Now is the time to think about what factors are important to you. You have healthcare needs, or maybe you're really healthy. Oh, here's another thing I get asked. I don't take any drugs, Susan. Why do I have to have a prescription drug plan? We'll talk about that in a minute. If that's you, great for you. You're in great health. Let's help you search and find a $0 premium plan just so you have something. So again, look at your healthcare needs. What's your financial situation? Do you want to pay $0 now, but know you have more later if you get sick? Or can you afford more now and know you don't have to deal with it? Find your providers. We'll help you look and see, are your providers in network? So pros and cons. Do you want to pay for things a little bit separately? Think about that, and then think about the timing. Know these things now. I want to take a breath and say myths. We get a lot of myths in my industry. And I get asked, well, don't I have to pay a fee for your services? Do I have to pay a fee for any broker? The truth is, no, we don't charge a fee for our services. We have no fees. We don't believe in that. Our sole purpose is to provide Medicare education. We want to help you get this right because you're going to be with this for the rest of your life. All right, myth number 2. Nobody works for free, and the insurance company charges more if I go through a broker. Yeah, that's not true. You're right, nobody works for free, but the truth is that you're going to pay exactly the same whether you go to another broker, whether you go directly to the insurance company. It's all the same. We just like to help you through this process, and what happens is that the insurance company pays us. Myth number 3. Well, if I get paid by we'll put it in your first person, if you, Susan, get paid by the insurance company, you must have a bias, you must have a favorite company, and that is not true. The truth is that we have access to over 23 different insurance companies, and we have 128 products. We get paid by whichever product and insurance company you choose. We don't have a bias. We want to help make sure that you have the right plan that fits your lifestyle so you can get health insurance now and make sure that it's the right thing for you. Now, this is different than shopping plans every year because insurance plans change, your health changes, you move. But the general thought process is we don't steer you to a plan. We're going to help you uncover and discover what plan is a good fit for you. The truths of using a broker are we don't charge fees. The price you pay to the insurance company is the same with or without a broker. And like I said, we have 23 different companies, and I believe it's 128 different plans that we offer and represent. Okay. There are a few additional costs that might be associated with your Medicare, and we want to talk about them for full transparency. Again, that education piece. The first thing that you're going to come across potentially is an income-related monthly adjustment. We call it an IRMA. And it's the additional premium you might be subjected to for both Part B and Part D if you're at a certain and or above a certain income level. Your income-related monthly adjustment is calculated automatically by a 2-year look back. So in 2025, we're looking at 2023 income, and I've got that chart up here on the screen. So what happens is Social Security does this automatically, and you can see that it's the modified adjusted gross income, and you can see how that works by looking at your 1040 line 11. I think I've got it here, yeah. And then add the tax exempt interest. Now, I'm not a CPA. Just make sure we have this disclaimer out there. But we can help you again. Remember, if you're starting to think about retirement, you're working and thinking about retirement, 6 months ahead of time, at least 6 months, really should be 7. Stop that HSA contribution and start looking at what's my look back period going to look like, and how is that going to affect my IRMA? We don't talk about it. I don't talk about it in this presentation, but there are ways to you'll communicate with the IRS and with Social Security and file a form to have that readjusted as needed and if needed. Again, that 2-year look back as we actually move into retirement where we are no longer bringing in income on a W-2. That's that Social Security benefit planning piece I talked about. So those will dovetail together, and you'll see that change and fluctuate and maybe even go back down. All right, the last piece to additional things are additional possible costs are late enrollment penalties. And I keep harping on timing. Timing is everything. And if you don't time this right, you could be subject to a Part B late enrollment penalty, or you could be subject to a Part D drug plan late enrollment penalty. And they work a little differently. I won't spend too much time here. Just know this. The Part B is 10% of the monthly average for every year. Every 12 months that you should have been enrolled in a plan and weren't. And the Part D drug plan penalty is 1% of the national average for every month you were not enrolled. And I will tell you that if you're coming off of an employer plan, I just got through telling you that you have a 6-month window for a Medicare supplemental. But when you come off of an employer plan, your Part D enrollment is 63 days. You don't have to memorize this. We'll help you walk through this. I've got that kind of listed down below in those reminders. Timing is everything. Work through your process and make sure you understand when you should be enrolling. And we'll help you with that. We'll help you put together a roadmap. In fact, you're probably already halfway there. See, my Medicare roadmap, I kind of laid it out for you. The first thing that you'll do is figure out when this is going to apply to you. Are you already receiving Social Security benefits? Not a problem. You are not receiving Social Security benefits, but you do need to enroll because you're turning 65, or you're on an employer plan and you're going to continue working. Figure out which of those two parts or both, A and or B. The next step is, are you going to be choosing some additional coverage? Are you going to do the separate route where you choose a Medicare supplemental plus a drug plan, or are you going to go the bundled route with Plan C that takes care of everything? So you're done with phase 1. You've taken the first step. You enrolled in my online video content. Congratulations to you. You've taken and attended today's seminar. The next step, you need to schedule your consultation. It's free. Schedule your consultation with us, and we're going to help you walk through the various plan options, get to know what are some of the things that are important to you. So we help you kind of pull the curtain back on your lifestyle, so you figure out when to enroll and how to enroll. And as a bonus for attending my webinar today, I've got my personalized Medicare roadmap that I'm going to send to you, as well as my customized cost summary. It's a tool I put together where you can plug in numbers and it'll do the math for you. I love that. Free lifetime billing and claims services. This is what sets us apart from everybody else. We pride ourselves in checking in with you and helping you get your ID cards, helping you, navigate the Medicare complexities when rate changes occur. We're going to reach out to you on birthdays and, of course, holidays. I love birthdays and holidays. Birthdays are my favorite. You'll have no shortage of help from us. And if we don't know the answer, we'll find the answer and we will contact the carriers and help you get through this process. You're also going to get free annual reviews. We're going to reach out and talk to you and make sure that things haven't changed. Have you moved? Have your doctors changed? Have your prescriptions changed? We want to make sure that you're still in the right plan. So let's get started. Click below now, schedule your call, and we'll get that bonus item number 1, Medicare roadmap, to you, and bonus item number 2, my Medicare cost summary for you, out to you. I thank you so much for spending your valuable time with me. I look forward to talking with you. Let's get started. I love talking about Medicare.